Good afternoon, and welcome to Exploring IT's Role in Strengthening Organizational Resiliency by Identifying and Closing Clinical and Business Preparedness Gaps, a health system CIO production sponsored by HealthLink Advisors. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we will take them later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35-40 minutes with our main panel discussion featuring Buddy Hickman, Chief Digital and Information Officer with Roswell Park Comprehensive Cancer Center, Nate Lesser, VP and CISO with Children's National Hospital, and Zira Thor, Senior VP with HealthLink Advisors. And then we will have our Q&A. So let's jump right in. Buddy, we're going to start with you. Can you give us an overview of your organization and your role?
Sure, Anthony, and thanks for having me join you today, along with these very distinguished guys that I happen to have the opportunity to speak with. I am serving as the Chief Digital and Information Officer here at Roswell Park Comprehensive Cancer Center. Roswell Park is named for the physician founder, Dr. Roswell Park, who was quite the innovator, healthcare innovator as a neurosurgeon here in Buffalo, New York Metro back in the 1890s. In fact, Roswell Park is likely the oldest of the cancer centers in the U.S. and amongst I think the first three NCI accredited comprehensive cancer centers way back when as well. A lot of things have developed here, both in terms of the research side as well as the clinical care delivery side of what we do here at Roswell Park.
All right, excellent, buddy. Thank you. Nate?
Sure. Thanks for having me. It's a treat to be here with you. I'm Nate Lesser. I serve as the Chief Information Security Officer at Children's National Hospital. Children's National is a 323-bed healthcare system in DC. We're a dedicated standalone children's hospital, one of the top-tier children's hospitals in the country. And as such, we have unique challenges that are specific to pediatric care. We have about 60 sites around the DC, Maryland, and Virginia region. And it's really an exciting opportunity for us for me to be here today and to be able to learn from you and my colleagues here and talking about this really challenging issue that we all face.
Excellent. Very good. Z?
Hi there, Anthony. Thanks so much for having me, and really honored to be part of the panel with Nate and Buddy. Zira Thor, based in Washington, D.C. I'm a Senior VP at HealthLink Advisors. HealthLink Advisors is a management advisory firm focusing on all things IT for provider organizations across the U.S. And I help co-lead our organizational resiliency offering that we call Blackout Blueprint that has tangential aspects to the topic at hand. This is a timely topic for us. We're seeing a lot of interest and eagerness among our clients to close care gaps and revenue cycle gaps and ERP gaps as it relates to when there's downtime. So how the business functions and keeps going when the systems are down. And I'll say, being in Washington, D.C., I really appreciate everything that Nate and Children's does because both my kids get care there. So this is the first time in my career where I'm a young father. I'm not young, but I'm a new dad-ish, and definitely get a lot of care at Children's. So Nate, I'm always appreciative of all the awesome care we get at Children's National.
Wonderful. Very good. All right, Z, we're actually going to start with you on this because you see a lot of organizations. How prepared are health systems for prolonged IT outages caused by cyber attacks or technical failures? And we'll get into the distinctions of those two down the road a little bit. And what do you see as sort of the biggest gaps or the common gaps you're finding as you deal with different people?
Yeah, well, I think it definitely varies. It depends on the vendor mix for the organization, depending on who they have. I think Epic clients get a lot of support from Epic in terms of how to operate during downtime. But as we were even talking, Buddy and Nate and I were talking before we even kicked off this, we opened up the discussion here before we went live. There's probably no perfect solution, right? You can always do better in terms of your preparation. So again, some clients are going to be better prepared than others depending on who their vendor partners are. I think one thing that I'd love to explore during the next hour with my colleagues is the challenges that they may face internally, given all the other existential threats that are going on there in the economy, in reimbursement, in workforce and workplace resiliency. So I think it varies by client, based on how well your partner is supporting you and how well the board and the C-suite is providing guidance and prioritization for this stuff. I think the biggest risk, and where we are seeing the conversation, is what do you do when the system is down for 30 days or more? And that probably is not an IT function. That's not an IT question to answer. That's really on the backs of the clinicians, the clinician leadership, the rev cycle leadership, and the ERP leadership, for them to say, this is what I need during a catastrophic downtime. And I think more and more clients are starting to ask that question, as opposed to the typical, what do we do when the system is down for 8 hours or so, or a day? There have been a number of incidents in industry where people are now really feeling the painful consequences of that catastrophic downtime, and that's causing boards and the C-suite to really reassess preparedness.
All right, quick follow-up there, Z. You mentioned, and this is interesting to me, that how you're going to fare may have quite a bit to do with the vendors that you're dealing with, and that Epic does a pretty nice job of, I guess, supporting their clients or giving them information or plans on how to handle downtime. That's interesting. I wonder if you could go into that a little more. And my thought is that CIOs would do well to find out what information the vendor can provide about downtime. Perhaps they do have information, playbooks, resources that you haven't even asked about, or maybe they don't. Maybe it does go by vendor, and it's one vendor, their position would be, that's your problem. And someone like Epic would be like, no, well, it is still your problem, but we've got some stuff to give you. Tell me your thoughts a little more around that.
Yeah, I think it's a shared responsibility between the hospital system holding their vendors accountable, and vice versa. Epic's got their honor roll, and it'll be great to hear from my colleagues on what's reasonable for the vendor to hold you accountable to. How much do you all expect for them to help you during that downtime or preparing for that downtime? And then how much of it is on the shoulders of the hospital system. But um, I think that the way that we start to help our clients is, how often are you talking to your vendor about what solutions or downtime forms they might have? What alternative workflows can they help enable during the downtime? We're hearing from our clients, hey, can you help me review my contracts to see if I have any non-exclusivity? So if my clearinghouse goes down, do I have the ability to maybe stand something else up in a week or 2 weeks?
Just
So,
hypothetically, if my clearinghouse goes down, right? Like that's never happened before.
right. And that's not hypothetical anymore. Or what happens when my time and attendance system goes down? How am I going to track time accurately? So it's not only engaging your current vendor, it's it's also taking the time to understand what are the other alternative technologies that I may have to deploy, kind of like break glass. If this thing is going to be down for 2 or 3 weeks, perhaps I just stand up an alternative system.
All right, Nate, let's go with you, and then we'll go to Buddy. But Nate, what are your thoughts about the things Z has brought up?
Well, I think Z's spot on, right? So the model I like to talk about a little bit is when you talk to infrastructure as a service cloud vendors, right? They'll all say there's a shared security model here. In your journey to moving things to the cloud, the infrastructure providers, AWS, Azure, Google, they will tell you we're responsible for security of the cloud, you're responsible for security in the cloud. Similarly, I think we have a shared security model. Z talked a lot about the vendors, and I think that's right, but we also have a shared security model with our departments and units across the hospital, right? Whether those are clinical units or back office, financial services, legal. And the way we've approached this at Children's National is to build out business continuity plans for every single one of those departments and units. This is an effort which I can't take any credit for because it was run by our emergency management team, and they're fantastic. Really, the only thing that my team did was say, hey, you guys have this incredible effort underway, building over 40 business continuity plans across every department and unit of the hospital. We're going to come support you, plug in where we can, and ensure that each one of those business continuity plans now has an extended network downtime section. So we don't care whether that's because of well, we care, but whether that is because of a cyber attack or because of some other network outage, we need everyone to be prepared for that to extend up to 30 or even 45 days. And we've seen this in the real world. Sadly, more frequently than not, we're seeing these extended downtimes come because of cyber attacks. And it's our responsibility as a security team to protect against those, to create an environment where we can respond to those types of attacks and to recover as quickly as possible when they happen. But to operate through that extended downtime, that's the responsibility of the individual departments and units. We will function as advisors in that role, but they have to ensure that they know how to keep clinical operations, to keep business functions running. And we've uncovered some fantastic, interesting, and frankly, really scary things through that activity. Things like, does everyone know how to chart on paper? Okay, yeah, everybody kind of has that top of mind. Do we have paper? Do we have paper charts available? Can we print out paper charts? Do we have printers that aren't connected to our network that are available to create more charts that people can use to chart on paper? I had a fantastic conversation where we use Pyxis, which is, for distribution of medicine, a controlled medication on every floor and every unit across all of our entire system. And that's a distribution system that can be put into a bypass mode. If it's unable to connect home, if their network is unavailable, you can put it into a bypass mode so that medication is still available. But until we went through this exercise, the process we had for putting it into bypass mode required you to send out a command from the central station over the network. And so we had this funny round robin where we were saying, well, what happens if the network's down? And we would hear, well, you just put it into bypass mode. We say, how do you put it in bypass mode? Well, we send out a command over the network. We said, yes, but the network's down, dear Liza. And it was, those are the types of learning activities that we've been able to really attach ourselves to. And I feel like have strengthened our ability to ensure that we can operate through a ransomware or other destructive attack.
Buddy, what are your thoughts?
Thank you for the bite at the apple, Anthony. To just take it a little further with the sharings, if I look at your base question and start with your fundamental question, you mentioned technical failures as well. And we generally, I find nowadays, because of the threat, we lean into cyber attacks. But I think most of us know a CIO colleague whose hospital suffered a significant fire the year before last. And that recovery process was extensive. So when we think about business continuity, disaster recovery, incident response, we should be thinking of many scenarios, always in mind, as Nate would tell us, with the notion of risk and risk registering those opportunities and building our scenarios around that. Now, if we move that discussion to cyber attacks, I'll just offer personally, like I think it was Saturday night, my wife and I started watching the series 0 Day. I don't know if you guys have watched that. It's the one that has De Niro playing the former president of the United States. It begins with this crazy cyber attack that exploits the rail systems in the U.S. My second night watching it, I realized at about 3 o'clock in the morning when I woke up, and Adam Rosen, our CISO, was in the same dream as De Niro, and was dealing with a response that I got to stop watching this kind of stuff because it's supposed to work. Okay. You mentioned the 30-day plus, both of you referenced the 30-day plus outage. And it could come in many forms. I think it's cyber, but cyber directly as to our own organization. Extend that because John Rigi from the AHA, formerly FBI, most of us have heard John speak and had opportunity to speak with him. He would say, make sure you're prepared for that, but also prepare for your entire region. You won't be able to do diversion when that happens. The region will be upset, or in the case of the movie, the globe was upset, right? So think about outside of ourselves, and therefore, if you do that, you think about business continuity, the kinds of challenges of business continuity are paramount because everybody's going to be struggling for the same resources. When I think about business continuity, and just talking with a number of colleagues, CIOs, I find the scenarios that people have found themselves in always add to the education. One of the things that Laurie Beaujolais, based on what they suffered through at University of Vermont, said to me along the way, was even that question in your incident response plan of having it documented as to how is it you have the dialogue and make the decision as to who's going to call the governor's office and ask for the declaration of state of emergency, ask for the National Guard to be deployed, and then what are you going to have the National Guard do? Re-imaging devices, working the supply chain for you, or whatever, and having all those roles defined. So you think about the gaps, Anthony, there's so much ground to cover to build out that kind of IR. And the other gap I want to mention so we can then move on is just the gap of disparity that exists across the healthcare delivery system here in the U.S. We're fortunate that some of our cybersec firms and professional services firms have begun offering virtual CISOs, offering scaled opportunities to have cyber extended because there are so many critical access providers, smaller community practices, smaller community hospitals that just very much struggle to put together the means to set up an extensive cybersecurity program. And if you're at a 100-bed critical access hospital, you fundamentally have to have the same protections in place as the 1,000-bed IDN.
Yeah.
And to think about trying to do that and demand that with such a smaller staff and a smaller budget is a challenge. So that's a gap that goes beyond. The other big gap, constant education. And how do we ever close that gap? Because all the way to the tops of our organization, we've got folks that we need to continually work with to help them understand that security is not convenient.
All right, go ahead.
Anthony, you
Yep.
mind if I want to just react
No.
to one thing Buddy mentioned? You talked about the critical access hospitals and the large IDNs. What we find is anyone that has come off paper recently is actually going to be adversely, or not adversely, what's the word I'm looking for? It's kind of ironic that they're the best prepared for downtime, for catastrophic downtime, because they know how to revert back to those paper processes, which I don't know how many times out of 10, maybe 4, 5, 6, 7, 8 times out of 10, that's what you're going to have to do during the IT downtime is revert back to paper. And we found a couple clinics that we were working with one client. They had those down like that. They knew exactly what to do, what to chart for the minimum data set. So it was ironic. And one of you all mentioned the docs. More and more docs now have been trained on prompts. The EMR gives them the prompt of how to document. So how do you get that legal medical record is a challenge. One thing that we're working on is, can we get some sort of automated PDF to help provide a light touch of how to document? So there's not going to be the right answer, but how can you make the pain? How can you reduce the pain during the downtime? That's for us to solve.
Anthony, you may want to start an aftermarket with addressograph machines if you can find any of them.
Very good. Very good. Nate, I want to follow up with something you alluded to before about understanding who's responsible for what with the business units, and you made the point that we're responsible for certain things and they're responsible for other things, and that's great. How do you make sure that's expressly understood? Because that's going to help them probably do some preparation that they maybe haven't thought about, or because there's gray areas, right? There's some things that are super clear, but then there's gray areas. You mentioned a printer. How do you know if you have enough printers? You mentioned the network. Well, there is an IT component to understanding some of this stuff, even though they may be responsible for getting printers and paper. There's an IT component to either that device not working or working at some point where there has to be a conversation. And I agree with you that clarity is the key. This is your lane, this is our lane. But those sound like conversations that need to be had so that we are on the same page. Your thoughts there?
Well, I couldn't agree more. Those are conversations that need to be had. But I think the thing that you mentioned that is perhaps most challenging is those gray areas, those spaces in between, which you're not going to know until you're in it, right? We all have this experience. So to some extent, treat every technical, what's the expression? Never forego a crisis, never
Never waste a
waste
crisis,
or
I think.
crisis.
Yeah.
So, treat every technical failure like an exercise, right? It'll likely, the fire example that Buddy mentioned, notwithstanding, they're more likely to be shorter duration than a malicious attack. So take advantage of every one of those. Learn lessons, do the ARRs. The other thing I would say is, and we stole something from our colleagues at Intermountain Health. They're really, I think, leading the way in terms of exercises. I mean, to co-opt a phrase, drill, baby, drill. We need to be doing this constantly. And they do something unique. There's something that I haven't seen a lot of other health systems do, but we're going to get started on this year. We're already started on, which is instead of big scale annual or maybe semi-annual exercises, do individual departments and units one at a time. So we're coming up with, we've got a scenario that we're running that is the one we're going to use this year, and we're going out to do it across 12 units across Children's National this year. Intermountain Health, I think, really is leading the way. They do 24 cybersecurity exercises a year. They do them, again, it's a smaller scale. You can take the same scenario and run it multiple times, but it's an interesting and I think unique way to challenge your teams, both your security teams as well as your colleagues and stakeholders across the hospital, to really be prepared for and identify those gray areas, those spaces in between, and bring those lessons forward. Because without them, you're absolutely right. There's always going to be things that you really, really wish you had thought of beforehand. There still will be, but this, I think, is perhaps the best or a critical piece of trying to get ahead of the curve.
Anthony, if I could jump in on that
Please.
one, I like the emphasis, Nate, on practice. If I take a step back, I generally think of this discussion as being business continuity, disaster recovery, and incident response. And those three things are just, they're inextricably linked. They need to be so documented in terms of scenarios. The whole notion of playbooks and all that makes that paramount in terms of knowing what to look to as a guide. But then you get into all of the variants that occur in a real live event, and the need to think on your feet. So I moved from the theory to just say, many of us were challenged by the CrowdStrike issue. And the CrowdStrike issue in our case was an event that we became aware of in the wee hours of the morning. We activated incident command, I think probably between 2 and 2:30 a.m. And generally speaking, and because of, I'd say, preparation mostly, as well as an incredibly willing organization to maneuver and manage. We were generally back on our feet by the end of business, a little bit after the first day, with only a bit of carryover into Monday for some final cleanup. So now, what does that mean though? Even though that was the case, I kept a log all day long. And once the dust settled and we reported out and all that, it was time to call the team together and do the postmortem and talk about what didn't go so well and the things that, on top of what went well, what we needed to do to improve. Practice every time there's an opportunity. It was only, I think, 2.5 months ago here, a major fiber carrier had a significant fiber line taken out in the middle of Metro Buffalo. It affected organizations all over town, including healthcare organizations here down on the Buffalo Medical Campus. Thank God for redundancy and rerouting and all those sorts of things that caused us to have a several second blip versus, if we had been singly threaded like many organizations may be or could have been years ago, we would have been down in that case for at least 48 hours till the fiber was repaired. So every opportunity, practice, document, look for the next improvement.
Excellent. Z, what are your thoughts?
I mean, I appreciate these two gentlemen are walking, the front line. So there's not much I can add because they're living the real world experience. I certainly, I think as we evolve what we do, we got to lead with training and the feedback loop. I feel like that's super, super critical.
All right, Z, let me get a little more specific with the question.
Yeah.
One of the sort of dynamics here that's kind of interesting to me is this a concept of scenario planning. Like, what are the scenarios we're trying to plan for? And there's a lot, and that makes it very challenging because you could have many, many different flavors of a scenario you're planning for. So there's the variety of scenarios in terms of type. There's also variety in terms of scope. Nate referred to, or Buddy maybe referred to John Regi talking about you got to be prepared for a regional outage where you can't do diversion. At some point, we get, and this is just like when you buy insurance, at some point, we get to scenarios that are very difficult and expensive to prepare for and extremely unlikely, which is not really a good use of your time. So at some point, that tips to, hey, I'm planning for losing, the western half of the US. And your boss is going to go, well, maybe you shouldn't worry about that right now. So there is, again, we talk about gray area. There's comically big, there's comically small, there's the gray area. So what are your thoughts around approaching this from a reasonable scenario point of view and that helping inform how you move forward?
Okay, I love the question. And Anthony, as you and I have talked in the past, and as you get to know me more, I'm a pilot, and it always goes back to piloting. And when you're learning how to fly a plane, they teach you three things: aviate, navigate, communicate. So, professional pilots, of which I am not, they get thrown. These machines are so automated, and they can do so much. And you can get overwhelmed with trying to find the gremlin, following the checklist of what is the issue? Is it a circuit breaker? Is it a hydraulic pump? They have all these complex checklists, but at the end of the day, keep the wings level, don't invert the plane, and fly straight. And I feel like that applies to the same thing here. Keep patience. What are the priorities? What do we need to admit, care for, and discharge a patient safely? What do we need to pay our employees on time? What do we need to keep supplies coming in the door? And what do we need to make sure that we document for the care that we gave during the downtime so we can bill for it at the end of the day? Those are like the four guiding principles of all of this work. At least that's how we look at it. And so if you can focus on, do the scenarios attach that, can you get the nurses to just focus on patient care? Can they just document that? If you bring it back to a root fundamental principle, like keeping the wings level, if a scenario can touch upon all of that, then I think it's, you see another cliche, rising tide will lift all ships.
Hmm.
That's the best way I can answer it, just with my, um, I always go back to piloting for some reason. I don't know why, but
Well, it's serious stuff piloting, right? So this is serious stuff too. Nate, what Z said made me think of what you mentioned about the Pyxis machine. Getting medications out is something we need to do to deliver care. So that's kind of tier one, right? If we can't give them medications, and imaging comes in there too, right? People are going to come in the emergency room. They're going to come in. They're going to need imaging. We can't do imaging. We can't care for them. You got to go somewhere else. And I don't know a lot about medicine other than being a patient, but there's the medications, there's the imaging, there's the blood draws, right? How do doctors figure out what's wrong with you? There's a few basic ways. And then the charting and all that. And that's where we say, how are we going to do that on paper? So I think Z's point is a really good one about this is a way to look at this. How do we care for a patient at its most basic 75 years ago level, right?
Yeah, I mean, I think foundationally it really goes back to this partnership that we talk about, right? So I am never going to know the critical functions that any one unit in our hospital performs as well as they will, right? Never. I'll never know them anywhere near well enough to determine how those functions need to be performed, how those capabilities have to be delivered. So you have to partner, right? And that's where you get to things like a list of your tier zero critical applications. Where do those have to live? How do we ensure that we can bring those back online? You know, as Buddy was saying, being ready to have as resilient a system as possible is really about ensuring that you've identified what's in your environment. And frankly, I will say, as someone who's been in healthcare only, it's coming up on 5 years now. I've been in the cybersecurity world my entire career, and the defense and risk management world my entire career. It is horrifying to walk into a hospital system and see that we have often very little handle on the scope of coverage, on an understanding of the assets in our environment, who owns which applications still exist in our environment, what devices we have and how well we can control them, which vendors have deep access into our environment and still need that access or don't. It's an incredibly challenging job. That's why it's also so exciting and fun. But I think at the end of the day, what we need to do, and your questions all sort of sound to me like this foundational approach of risk management, right? And there are really only three things we can do with risk, right? We can mitigate it, we can transfer it, and you started to talk about insurance a little bit, Anthony, or we can accept it. And in the scope of those three activities, the only things that we actually can do with risk, we have to think simultaneously about both those low risk but high volume events and those catastrophic risk but infrequent events. There's some really great literature on this. There's a book by Cass Sunstein, who, if you've spent any time in the risk management world, you probably know, and he writes books faster than I can read them. But he's got a great book called Worst Case Scenarios, which is really about how do we, not overreact and not underreact to low frequency, high impact events.
Very cool. Now I have a new book recommendation to. Hopefully he did the audio because that's my favorite. By the way, Nate, I just have to mention that in describing your work and your job, you use the words fun and horrifying in the same description. So that's when you know it's exciting.
Takes a special kind of person.
Fun and
Be
horrifying.
excited.
Buddy, what are your thoughts?
Well, your jumping off point, Nate, reminds me of capability and maturity frameworks, which have been around for a long time in the world of IT. In fact, back in the days when I was writing methodologies, we had the old joke of, what's the difference in a methodologist and a terrorist? You can negotiate with the terrorist. But if you think about, frameworks and capability models, let's sweep it over here in the cybersec world and talk about enterprise risk assessments for the sake of having an enterprise look at risk and having that risk codified and scored based on the impact and the likelihood, right? And so, we can't say enough about the need to have organizations focus there too, and having those enterprise risk assessments done, and having that being something that's continually updated as your situation changes. So you always have something to look to that tells you what the next priority is that you're going to be working on. Nate, if you ever catch up on the ones that you're actually working on right now, because we all are challenged by that. I think in addition to just referencing the frameworks and that approach around vulnerability, there's much to be said as to the connection again between those frameworks and the business. So you went there already as well, but the thing I would add to that is, we often think about talking to the business about helping us understand the priorities for recovery. Let's pretend the scoring criteria is ABC, where A is like, we got to have it back fast. B is like, okay, we can tolerate it for a couple of days, C, it can wait. But it's never that linear because the way systems work, they're all interconnected and they have upstream and downstream data exchanges. And in fact, Z, I think about you being a pilot and the concept of safety and really understanding the stream of safety. You could bring up a system downstream. The downstream user might believe it's still being fed by upstream and it's not, and create a safety consequence for a patient. So understanding the interrelationships between the systems and the data exchanges and bringing the systems back in the swatches that you need to bring them back in is critical as well. And that even again is something that might happen in the moment based on the scenario you're dealing with, right? Because the scenario difference may break apart what you had documented, and you have to be able, in the light of day with your colleagues, sit in incident command and make the decision, okay, today we think it's these 5 things we're going to bring back. Does everybody get that? Okay, now let's talk about the consequences that go with that, the communications that have to go with that, and then what do we have to do with all the peripheral stuff that we're still not touching? It gets incredibly complicated really fast. And so, again, the practice part of it, Nate, I keep going back to your mention of that, is again hypercritical.
So this is really good stuff here. So what I want to delve into right now is we talked about reasonable scenario planning, and that's important to make sure you're sort of on target with the scenarios you're looking at. We talked about the idea of needing to be flexible in the moment because you're never going to have the exact scenario picked out. There's so many flavors and so many types of outages, so many vendors. There's cloud, there's on-prem, could be cyber incident, could be not cyber incident, many, many things. So the question, I'm going to start with you, Nate, is how do you plan or plan to create a structure, and Buddy referenced incident command. How do you create the structure to have flexibility in the moment, right? Because we know we need flexibility in the moment to deal with the situation as it comes up and as it evolves and changes. How do you build for that so you have that when you need it?
I think it's a great question. Like most things I have found here, it's a lot easier to co-opt good ideas that your colleagues have already put forward. So in incident response, for example, we are trained across the cybersecurity world about all the things, all the external components that we have to bring into a cyber incident response plan. Okay, right? Yeah. Don't forget about PR. Don't forget about legal. Don't forget about compliance. Don't forget about risk. Don't forget about communicating with executives. You walk into a hospital system, and if you don't have a cyber incident response plan, guess what? You have emergency managers. You have to, right? And they already have a crisis communications plan. They likely already have an emergency operations plan. And all of those components I just mentioned are already a part of that, right? You have an AOC to an administrator on call structure likely, and you've got some of those pieces pre-canned, built for you, and frankly, they're exercised, not really exercised, they're implemented on a much more frequent basis, right? We have a flood in OR2, right? We have to spin up the AOC. Okay, so we already have those communication channels and structures built. They are resilient. They are flexible. They do all the things you just mentioned, Anthony. They may not be IT resilience. They may not be cybersecurity oriented, but we have a lot of good work that exists already that we can just borrow, that we can steal, that we can build on top of. And then, the other place that I go to is colleagues like Buddy, colleagues like Z, to the broader community. The Children's Hospital Association has a group of CISOs that is in like daily communication on Signal. We're constantly sending each other messages. Chime, we mentioned earlier, American Hospital Association. Buddy mentioned earlier, of course, HISAC. There are these communities that we can learn from as well. So is it easy to be flexible in the moment? No, of course, it's very challenging. But I think we already have, none of us are starting from scratch. And the great news is that even when it feels like we are building a plan for a hospital system that has never had one before, there are already a lot of structures in place that we can leverage.
It's a great
That
point.
was
Go ahead,
that.
buddy.
I was gonna say that was an incredible answer. It really
Go
was.
ahead. Well, you
And
got anything to add on it, buddy?
well, you did the laundry list. It's so true in terms of the things that we already have in place. I mean, codes are called daily, and there are all the various kinds of codes that get called. So there is the exercise of a group of people that hear that code called. They all know how they're supposed to react as to their role. They know what's supposed to be deployed with them when that occurs. And things should happen well into lockstep with that discipline and practice. And, Z, I was thinking about your reference of being a pilot. It reminded me of a conversation that I had with a guy named Steve Kreiser. Steve is a spokesperson for Press Ganey. He's an employee of Press Ganey, who everyone knows is all about their, the safety and reliability, high reliability culture for our organizations. He was a Navy pilot, and in fact, the trainer of Navy pilots eventually. And the reason he is a part of that team is he comes in and instructs from the perspective of a Navy pilot and the exercise of every team that's required to get that jet in the air and to bring that jet back down.
Mm-hmm.
Then all the trainings that go on and by between the pilots in terms of the repetition of how to bring, your jet out of a specific spin. And they're just sitting and counseling each other with what are the steps, because it has to be mechanically and virtually trained, right? To your body and your brain to do it. And to me, those things are amazing. But it is what we do with codes every day. What we're talking about here, Anthony, is how do you raise the scale of that to something that requires a lot more people involvement with a lot more engagement and have it all hold together, and hence the complexity of it. And so there is beauty in what you said, Nate, because it's a good way to start the teaching and then lift that teaching to, okay, now let's translate that to what running an incident command is really like, when now we're doing it for the sake of running the entire organization day to day for a protracted period of time.
Z, any thoughts there?
Yeah, as Buddy and Nate were both talking, it occurred to me when I in school, back in school, we had the pleasure of hearing from the founder of Ritz-Carlton. This was before they got bought by Marriott, when Ritz was on its kind of premium brand, which it still is. But they talked about focusing a lot of training time on critical thinking and emotional intelligence.
Mm.
And so there is all this training that we can do. What happens when the EHR is down? How do you do medical reconciliation when this is down? How do you order a lab order when the system is down? How do you get prior auth? We could teach all of that. How do you change your password? How do you secure your laptop? There's all this training that we could do. This is all this simulation that we're doing. And as Buddy and Nate were talking about flexibility, it just occurred to me that there are probably lessons that we can learn from other industries like customer service. And Ritz-Carlton has this expression, ladies and gentlemen serving ladies and gentlemen. And everyone, top down, from the manager down to the doorman and the custodian, they're all empowered to make a delightful customer experience. So if I'm a customer who's complaining about God knows what, the frontline worker is empowered to use their brain and use critical thinking and have emotional intelligence and empathy, and they're empowered for like $2,000 to offer me something. So if we take that lesson, how do we apply? We can train our employees on everything technical and protocol and this and that, but how are we also supplementing there with critical thinking, emotional intelligence, and empathy? And that also is another example of rising tides lifts all ships.
Boy,
Um,
that's such a good point, Z. It makes me think about how we hire.
Mm-hmm.
So to community-wide, thinking about cybersecurity in general, outside even of health, and we have such a, I think, propensity. We talk all the time about the talent shortage, and yet we have this propensity to hire for specific skills related to specific platforms or tools or products. We say, does the person have a CISSP? Good, okay, check. We can bring them in, as opposed to saying, foundationally, is this person a good problem solver? Do
Mm.
have both, yeah, maybe there's some baseline hard skills they have to have. Do they have the soft skills? Are they able to, in fact, come into, whether it's an incident response or, as you said, a scenario where we need to respond in a customer service kind of fashion? Do they have the ability to communicate? They have the ability to think critically and problem solve on their feet. I think we could do a lot better as a cybersecurity community in terms of building out our resilience by hiring people who are excited about being and learning cybersecurity, but may have been trained in a wider variety of ways.
All right, very good. We have an audience question from our good friend Bill Spooner, who I'm sure many of us know well. I think this is going to touch on emergency management. I always get that mixed up, whether it's emergency management or emergency services. But you tell me if they're different. Or one of them might be the clinical people that come save your life. But anyway, he wants to know who should lead the downtime response, ensuring consistency across the organization. I'm also thinking that's going to relate to the scenario that we pick. But I would like to get that. So consider, with those other thoughts around scenario and the role of emergency management, who should lead the downtime response, even if it involves that person including conversations with the CEO, perhaps when necessary. Maybe, right? Because sometimes you're going to be talking up to someone above. You're going to be maybe. Anyway, that's enough there. Buddy, let's start with you.
Well, first of all, Bill Spooner, hey, hope you're doing well, and good to hear from you. Let me speak from history on that one. My best experiences in an incident command scenario came from the years I spent in another academic health science center on the other end of the state. And truly, the best and finest leader that we had running our incident command for those types of events for a long period of time was what I would call the clinical chief information officer, or excuse me, operating officer. And by that I mean we talk about the hospital enterprise itself having a chief operating officer who also happened to have come up through clinical operations, was a nurse by training, managed all of the diagnostic and therapeutic areas, and really knew the operation and how the operation worked. So whatever the scenario where it was, Bernadette, Bernadette Pedlow just did a remarkable job of sitting command at the front of that room, knowing the roles that they were supposed to conduct themselves and seeing us through pattern. In that case, the IR person in the room that was really like the regional command center type person mostly made us, keep cadence and, observe the pattern of the room of everyone checking in and cross-checking and doing the things that you do. But the person at the front of the room really knew the operation, knew it cold.
Nate, any thoughts there?
Well, no, I think Buddy hit it right on the head. I would say one of the things that you need to do is continue to evolve that process as you learn lessons from internally and from others. So if assuming you have some kind of administrator on call structure and an emergency operations plan, the question of who should lead is, I think, an interesting one. We tend to have a two-tier structure where the incident commander leads the team of hospital AOC. So that's medical on call, legal on call, the executive leadership that's, who is interfacing with our CEO, the administrator on call who's coordinating across all of the necessary resources. And then if it's a cyber or IT incident, we have a technical bridge, we have a technical on-call team, and there's an interface between those two. And the technical on-call team has its own incident commander and reports up to the AOC team. That structure has worked pretty well for us. But I think it's, hospital by hospital specific. The reason, in part, Bill's question is so good because I think it does vary. But the key in my mind is to make sure that you have it, that it exists, that it's clear, and that you use it every time so that you get better at identifying those gaps.
Z, anything you want to add there?
No, I think it's best said by what Buddy and Nate have said.
All
I
right,
think
go ahead.
the one thing I would add, Anthony, is just the feedback loop is critical to the whole thing. After action report, I know Nate had talked about after action report and the learnings, just to inform, the next version of your guide.
100%. 100%. All right, no, we have another audience question. Can you give a short base scenario description that has worked well to engage with the individual business units? Buddy, let's start with you.
Repeat the question, Anthony. A short.
A short sort of a description scenario, base scenario description that has worked well to engage with the. So I think the idea is to engage with an individual unit. You're giving them a scenario that you would want them to plan for. So, hey guys, let's say this happens, which could happen. What would you do? I need you to think about what you would do, and I'm going to come back to you in a month, and we're going to have you can give me your homework, and we'll talk through it.
Okay, let's assume that no one's going to put this to Microsoft Copilot when I'm done to see what the answer might be. All right. All right. The scenario is that the organization was just hit with a significant ransomware attack. We're still learning. We've been doing our best to isolate the attack, and the best that we can tell is for now, we have no connection to any outside internet or hosted services. We're still not quite sure where we stand with regards to any on-premise storage capabilities. And so for now, we need to declare ourselves hard down. And by hard down, generally speaking, we may bring back computing capabilities as they're isolated, not network connected. But for now, we need to go to a response that says everything has to go to manual and on paper. Let's start there.
That's good. Z, any thoughts on that scenario?
Another thing pops into my mind, the show on MTV called Scared Straight, where they would take young kids to the prison and they'd see the horrors of that. Buddy just outlined a pretty horrific scenario. How does it get? I don't think it could get any harder than that.
Nate, and the interesting thing here is, and you mentioned this in one of the scenarios you described, is sometimes it's shocking the assumptions we can make about what's going to work that obviously wouldn't, but people just make those assumptions until you kind of walk through the scenario and they go, oh yeah, well, we would just call. And you would like, no, in the scenario I just gave you, you can't call. Oh, I've heard that not just from you. I've heard that from other CISOs and CIOs where they've put scenarios to units who have come up with solutions that would not work based on the scenario.
Yeah.
So anyway, it's just interesting.
Yeah, but I mean, Buddy's scenario is the scenario. Right? Like,
okay, good buddy, you
no,
got it.
So I will say like that's the one, right? That's the one that works across every department unit. It's the one that we all worry most about far and away. We have spent a little time recently trying to come up with others only because I think people are starting to get a little sick of Nate talking about ransomware.
Mm-hmm.
And we picked up on one just to, add a little variety in here from an attack last year. I think a lot of people have seen this, but it was a CFO not healthcare, was invited into a meeting with 6 other people. It turns out he was the only actual person. Everyone else in the meeting was a deep fake. And they managed to swindle $25 million out of this organization. That has caused some concern amongst our board members and others asking questions. So we have recently added some augmented training around deep fakes and what you can do to combat them for our financial. This is specifically to our financial teams, treasury, accounts payable, payroll, and training frontline staff on how to address, hey, I got a text message from our CFO that told me to do something. It seems a little sketchy. What do I do? Or I got a call and it sounded just like our CFO and he told me I needed to do this thing immediately. What do I do? My team's put together some really fun training. Unfortunately, it also involves me singing Beyonce as the technique that they put together, which nobody should ever hear.
I want to hear it. I'd love to
I
hear
can
that.
handle the singing. I don't want to see the dancing, Nate.
Oh, that's
Fair
true.
enough. Even worse. Thanks, buddy.
Anthony,
All right. Yeah, go
one thing
ahead.
I'll add, again, as Buddy and Nate were talking, Apollo 13 came in my head and how NASA'd a solution to bring our astronauts home. What Nate was talking about, all the different devices that are out there, but he was talking about Pixis. Our frontline end users can NASA a solution, right? And the scenario that Buddy represented allows your team members to NASA that solution. Like the glucometers have downtime capabilities. Do they know that in advance? Chronos clocks can accept 1,000 punches, so we can still capture time. But the downtime process is someone needs to go and get that data every 7 days. So you can NASA, you can figure it out. But the scenario that Buddy outlined helps stress test how we can fashion a response because there is capability there. You just perhaps don't even know it.
Yeah, go ahead.
Anthony, yeah, the one other thing I'd add, yeah, I gave kind of the horrible one, and usually the horrible one, when you're announcing it, you're still trying to figure out what way is up.
Mhm.
That's the whole point. You're going to get a flood of questions, and you don't know the answers to them. So all you know is what you have available to you. It could be the scenario, could be we don't know why, but all of a sudden it seems that we've had all exterior telecom, outwardly facing capability is gone, meaning, internet, fiber, satellite, etc. And I believe that could be a likely scenario one day where that kind of capability is taken away. So in effect, you're isolated, and then how do you react to that? That's the whole point. I think as we think about writing the script for incident response and those scenarios, we do need to think of multiple scenarios and write scripts for multiples, and then take the script that's most like that scenario and then vary from there, because there's never going to be one size fits all.
Before we
and
close, Anthony, I
yeah,
want to take 30 seconds to plug something that's entirely based on what Buddy was just saying and what Z was saying before that, which is we can empower our frontline staff. At Children's, we put together this thing called Code Dark. That's probably backwards on your screen, but you get one of these cards, every single person across the hospital, and it's 4 steps. What do I do if the hospital calls a Code Dark, which is our code for a fast-paced, malicious, destructive malware moving across the network? If we have a ransomware attack, we call it Code Dark, and every one of our frontline staff is empowered to become a cyber first responder. They have a couple of clear, very simple actions they have to take, and it really reduces that blast radius. So that's something that I think, picking up on what these guys said, we all have to be a part of the solution. And it's incumbent upon us to help our staff understand how to become a part of the solution. They're desperate to. So let's let them be that.
Wow, that's incredible. And we're certainly at time, but man, great discussion. Regarding continuing education, you can use the final slide in this deck. You'll get an email when the on-demand recording is available for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team. You go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Buddy Hickman, Nate Lesser, and Z Rather. And I want to thank HealthLink Advisors for making this event possible and you for attending. And with that, everybody have a wonderful day. Thank you.
Thank you.
Thanks.